I found out I was BRCA1 positive at some point in the haze of like my 10-day hospital stay after having like emergency ovarian cancer debulking surgery. I didn't really educate myself on BRCA or what that meant to have BRCA until I was kind of through the haze of that surgery and like on my path into chemo, which was like within 2 weeks of surgery. In that journey of going through chemo and cancer and like how horrible it was, I had a lot of time to like research BRCA and what that meant for me, what that meant for my daughters. That gave me a really solid foundation in which to decide to get a mastectomy.
So in terms of Randee's surgical plan, she came to us from Alaska, referred by another friend and colleague with the diagnosis of her BRCA mutation. What a BRCA mutation means is that the patient has been born with an abnormal gene. We refer to it as a mutation. Having that abnormal gene does put the patient at increased risk for the potential development of breast cancer and ovarian cancer. For women with a BRCA gene mutation, that risk for breast cancer may be as high as 87% lifetime risk. My approach when I first meet a patient who may be at increased risk for the potential development of breast cancer is to establish trust in a relationship. And I also introduce the concept of undergoing, when and if she's ready, prophylactic mastectomies for breast cancer prevention.
After a long discussion with Randee about all the various different options, what Randee and I settled on that was the best for her, according to her preference, was to utilize her own tissue in the form of a DIEP flap and augment that with an implant, what we call a hybrid breast reconstruction. And that was a unique form of reconstruction because it really is creating the most natural environment with her own fat in front of an implant reconstruction. What we also did for her was we did a nerve reconstruction where we're able to provide sensation back to the breast. You see, Randee came empowered, right? She wanted to know what's the best option for her, not just the best aesthetic outcome, but the best recovery with the least amount of pain, with the most amount of sensation. And it's a great time in medicine where we can really tailor a treatment plan to get them all of these options or all of their desires fulfilled.
Katz Women's Surgical Center at Glen Cove Hospital, they really have providers that comprehensively integrate for your care. So whether it's the ovarian or the gynecological aspect of your care, your emotional well-being, your hormones, your physical body and rehabilitation afterwards, or the breast reconstruction or mastectomy surgeries, all of that can be done at Katz Women's Surgical Center at Glen Cove Hospital.